Coming up on February's episode of the CANdid Connection, Andrew spends some time talking about what's been happening in Lansing as we take a look at the governor's State of the State address along with her budget presentation to the legislature. We chat about that a little bit. We also provide some updates on what's happening on our major issues around oral chemotherapy fairness, along with our two budget asks for tobacco prevention and cancer prevention. We spend a few moments talking about things happening in D.C. with the Biden administration reinvigorating the Cancer Moonshot initiative. The president brings together those working in the fight against cancer, including our CEO, Dr. Knudsen, along with President Lisa LaCasse from ACS CAN to the White House to talk about this exciting initiative and getting that jump-started once again. For our McLaren and Karmanos moment, we welcome Kristian Wilks, who's a genetic counselor with the genetics department at Karmanos Cancer Institute. Kristian and I chat about genetics, what genetics is, and why it's important in the fight against cancer. We also have an opportunity to sit down with State Senator Curtis Hertel. State Senator Curtis Hertel is the minority vice chair on the Appropriations Committee in the Senate, so we chat with him about the governor's budget message, what he feels like her priorities will be, and what issues will be important for the coming budget for the coming fiscal year. So all that in a packed February show. I'm Andrew Sheppers along with Ashley Hall. This is the CANdid Connection, brought to you by Karmanos Cancer Institute and McLaren Healthcare, the largest provider of cancer care and research in the state. Hello, folks, and welcome to the CANdid Connection. Of course, this is Andrew Sheppers, your host, and welcome to February's episode of the CANdid Connection, where we've got a lot to chat about this month, and so excited to talk about a lot of topics happening here on the state and also on the federal level as well. Again, I'm Andrew Sheppers, and as you can see, I am here by myself today. My co-host is actually out, and so we're looking forward to having Ashley back next month. But yeah, let's go ahead and get started today and talk about some things happening here in Michigan. And so between our previous episode and our episode today, a lot has happened here in the state level that really kind of kicks us off for 2022. And so, first thing we talk about is the governor's State of the State address, which really focused on, building Michigan back, recovering from the pandemic, and really focusing on some of the major issues that came to light during the pandemic. And so, focusing on making sure our kids are safe in schools, focusing on making sure people are getting good quality jobs and are able to get back and get back into the workforce, and then also to continue to grow our economy. So, left out of her State of the State, which was a little surprise to us, feeling like it felt within the pandemic, was really focusing on prevention efforts and getting back into screening and really focusing on that. So we're moving forward and excited where we have to go, and that leads us into our next topic and gets us into the governor's budget address. And so the governor also offered her budget recommendation to the legislature. And so looking at everything they had, all the gross funding they had, so federal, state, restricted dollars, things of that nature, the state's budget this year was around $74 billion. And so, it's the first time the budget has ever been that high before. And so, we're kind of into some new waters here. But out of this, the governor really focused on a lot of the main points she talked about in her state of the state. she made that an emphasis in her budget ask, right? And so a lot of helping to build up our economy, making sure that people are getting back to work, supporting our educators, and supporting our frontline health workers. And so, excited to see some of that. But yet again, prevention really wasn't a part of her budget address as well. And so we had made the ask to have our budget asks included in her recommendation, and unfortunately they didn't make it in. So I'll be going over those in just a little bit, but yeah, so moving forward, the budget process has started here in Michigan, and we're expecting a lot to come out of it, and a lot more pieces to be settled, and on where things are going to go. And so with that, with that movement, that includes our two budget asks as well. And so we are now meeting with members in the House and the Senate to talk about our two budget asks, which will be a part of our Cancer Action Day. And if you don't know what that is our state lobby day here in Michigan, where we provide the opportunity for volunteers to meet with their lawmakers. And so we've got a lot of good stuff planned. And if you're really interested and want to know what's going on, look at the website streaming down below. But for those listening, it's fightcancer.org/MI. It's got all of our information there. And you can register for our Cancer Action Day, which will be on April 28th. So again, head to fightcancer.org/MI to get more information there. But we have two budget asks this year. And the first one, we talk about this prevention, right? And so we really want to focus in on cancer prevention. And so if you were with us our last episode in January, we really talked about this, but just to kind of review, we're asking for $2.8 million to support our breast cervical cancer control navigation program. And so, what is that program? That program is a state-run program, which they receive federal funds to run. But what it does is that it gets those that don't have health insurance, or maybe, don't even have access to good quality health care. We get them into a breast and cervical cancer screening. So that's pap smears and that's mammograms. And we ensure that we get folks screened to make sure that, if unfortunately they do have cancer, we have the opportunity to catch that early. And so, we right now, Michigan has one of the best programs in the country, and some other states have modeled the work that we've done to do in their state. But we're at a point where the money that they get to run the program is purely federal money, right? And that's a grant that they have to write for every 3 years. And so, that money can only go so far. And so we're asking for an additional $2.8 million to essentially get out there and reach the people we aren't, reach the women that we're not reaching, that do need to be able to, get those screenings or have the opportunity to, essentially help them navigate through the process if those screenings come back positive for cancer. That's one of the great things about this program, is navigation is part of it as well. And so, they're there to support you all the way through the process. And so, this funding, this $2.8 million, especially now that we're, hopefully, fingers crossed, coming out of a pandemic, we need to make sure that people are getting back and getting screened again. So that's ask number one. Ask number two, I think those that that follow our show and listen know that tobacco is a big issue for us, right? And so tobacco's back again. And we're trying to get an additional 10 million to do some work around tobacco prevention. And so what does that mean? That means educators in our local areas, in our counties. That means greater outreach to multiple different communities around the state. And when we talk about that, we talk about our African American Latinx communities. We talk about our LGBTQ communities, like communities that traditionally we haven't been able to get into before, and really reach and let them know that there are resources available and that we're here to help. We want to make that impact now. And so as health equity continues to be a bigger issue, and continues to show the need of being addressed, and essentially, if we address health equity issues, everyone's healthier at the end of the day. Providing this funding is going to help us in our efforts to do that. And so again, if you listen to our last show in January, we talked about this a little bit, but just some quick facts around this so that folks understand. Michigan right now spends $1.8 million in their prevention efforts here in Michigan. And unfortunately, we find ourselves in a position where the Centers for Disease Control, folks that are really looking at tobacco addiction and looking at tobacco use, they say, for the state of Michigan to have a successful program, we need $110 million on an annual basis, not just one time, but an annual basis. And so we got a lot of work to do. And knowing that if we can get those extra dollars, anything at this point is going to help us move forward and be able to reach. And then we can continue to work to hopefully get to the levels of where we need to be a successful cancer prevention organization here in Michigan. So, we're excited about those asks right now. We've been having great conversations with lawmakers. They get it. They understand it. They know that prevention is necessary. They know that prevention not only saves lives, but saves dollars at the end of the day, right? I mean, folks that work in this space know that for every dollar you spend on prevention, you save $3 on the back end for treatment. That can't be more true than it is for those in the cancer space. And so if we can catch it and prevent it early, we're going to have healthier people. And it's going to be a lot easier to take care of them down the road. So, we're really hoping to see some action and have these asks included in the budget coming up for fiscal year 23. Shifting on to our other issue here in Michigan. All of you, followers of the show know that we've been working on oral chemotherapy fairness for 16 years now. If you head to our website, fightcancer.org/fairness, you can actually see how many days it's been. We have a counter that's on there, and it tells you how long it's been since we've been in this fight. We also put resources in there too, but fightcancer.org/fairness to get more information there. But we continue the battle, right? And I can tell you that now the bill sits in the Senate. I can tell you the Senate is very receptive in terms of what we're trying to do, and they've been very engaging. And so, we're excited about the progress that we feel like we're making, but we know that there's still much more to come. So again, head to that website, fightcancer.org/fairness, or, just head to our regular website at fightcancer.org/MI to go ahead and get more information, see our action alerts, and what's happening in the oral chemo space. All right, so let's go ahead and switch gears here and let's talk a little bit about what's happening on a federal level. And so, some real exciting news coming out here in the past few days, and that the president of the United States has restarted a program that he was a part of when he was part of the Obama administration, and that is the Cancer Moonshot initiative. And so I think all of you know that, we talked about some federal issues earlier on. There was a provision that the president put out in his State of the Union address last year talking about ARPA-H, so advanced research, but in the health space. And so from that point, things have continued to move, and uh, so um, so here in the first full week of February, the president announced that he is going to restart the Cancer Moonshot. And so, if you see in the picture here, this is Dr. Knudsen, the CEO of the American Cancer Society, along with President Lisa Lacasse from ACS CAN, meeting with the president at his kickoff and chatting with him and saying thank you and appreciating his efforts in the fight against cancer. And so, we're really excited about these efforts. And now, as we move forward, the American Cancer Society and ACS CAN are now excited and committed to be leaders in this effort. And so, we're really excited about what the Cancer Moonshot is going to mean for just not cancer patients, but those that cancer may be still yet in their journey, or those that are caring for loved ones with cancer. We know that now the president is committed to essentially making cancer a thing of the past. And so, exciting stuff there in terms of what's to come and what's going to be happening. So, but a lot going on. I know that there may be some other things coming down the road a little bit on cancer funding, on possibly a new round of Cures 2.0, which is, I think all of you know, that was an issue that we worked on earlier with Congressman Fred Upton here in Michigan. And so some exciting stuff yet to come here in Michigan and on a federal level in the fight against cancer. So, stay with us in terms of being able to find out a lot of that information. But if you're interested in seeing what Dr. Knudsen did and whatnot, meeting with the president, head to cancer.org. A lot of information there, pictures. You can see stories from that a day. So again, cancer.org to go ahead and find information, or head to if you head to our website, amplifycancer.mi, we can also get you into some of those places as well. So, all right, shifting gears again, and normally you'd be hearing from Ashley at this point, but I'm going to take a stab in terms of working on some of the grassroots activities, and really, kudos to our Michigan, Indiana, and Ohio teams for putting together a volunteer training that happened a few weeks back. Great information was shared. A lot of topics were chatted about, and so just a great opportunity for volunteers to get together virtually and really talk about issues they're facing in their state, but essentially how they can come together and work together to go ahead and push our agenda forward. So real exciting stuff there. But also now we are moving into getting ready for Cancer Action Day, and that is again our lobby day here in Michigan. We're super excited about it. That date is April 28th. And registration's on our website now, fightcancer.org/mi. So go ahead and check it out if you want. But we're in the processes of getting things going and planning. So, as we get ready and as we move forward, I know that some folks have been a part of our Cancer Action Day before. If you have suggestions, I know we do a survey at the end of the year, but we still love to get them. And so, scrolling down to the bottom of the screen are our email addresses, but shoot us an email at andrew.shephers@cancer.org or ashley.hall@cancer.org. And, we'd love to hear from you and hear your suggestions in terms of what we can do to make sure that your day in Lansing is most successful. So again, feel free to shoot us an email, andrew.shephers@cancer.org or ashley.hall@cancer.org, or head to our website again at fightcancer.org/MI. All right. Well, February is Cancer Awareness Month. It is also Black History Month. And March gets us into colorectal cancer month. And so, our Karmanos McLaren Moment today, that's coming up here next, focuses in on, genetics and why it's important that we focus on genetics. And so, we're really excited that, our questions coming up with our next guest from Karmanos is really going to be interesting, and how it all really ties together. I think a lot of or I would hope most of that folks in our African American communities really struggle with higher incidences of colorectal cancer. And so, we're excited now to kind of hear how genetics may play into that and why it's important to go ahead and make sure that you make your screening. So now we got an opportunity to move into our Karmanos McLaren Moment, where we'll be chatting with Kristian Wilks, who's a certified genetic counselor working in the genetic counseling service at Karmanos Cancer Institute. So enjoy our Karmanos McLaren Moment. So February is National Cancer Awareness Month, and for us, that really means when we're talking about awareness, we talk about prevention, and prevention really talks about screening. And so, it's vital for those that are trying to essentially prevent their cancer instances from happening, ensure that they get screened. And so a big part of that is actually in genetics. And so we're really excited today to welcome a guest who works in that field at the Karmanos Cancer Institute. And so we're happy to have joining us Kristian Wilks, who is a genetic counselor in the genetics department at Karmanos Cancer Institute. Kristian, thanks for taking a few minutes to chat with us today. We really appreciate it.
Of course. No, thank you, Andrew, for having me here. I'm happy to be here. Happy to be talking about genetics today.
Yeah. So, let's start right there, right? Like when patients get in and either meet with their physicians, or even when they hear, like through a podcast or on TV, when people talk about genetics, what does that really mean?
And that's a great question. I think today, when we hear genetics, there's a lot of different things that go through, a person's mind. There's, the rise of ancestry testing, 23andMe, any kind of doctor's appointment you go to today, there might be a different kind of genetics they're talking about. When we talk about cancer genetics and genetics in the setting of cancer treatment, what physicians are referring to is testing for essentially typically genes that you're born with, or genes that are relevant to increasing your risk to develop certain types of cancers, or genes that genetic mutations that are in your tumor that can actually increase sometimes aggressiveness, or can give us clues to determine are there certain effective treatments for your particular cancer. And these genes are things that we are born with, but sometimes can change over time. So they're really talking about testing to see, is there a risk that is being passed through your family that you were born with that is increasing your risk for certain types of cancer.
Wow, that's amazing stuff. It sounds like it's really kind of personalizing somebody's cancer treatment, but their cancer journey, and I guess that's why it's so important in the fight, isn't it? Because we're now kind of honing in on that a little bit. Is that
It
right?
is, and yeah, and we continue to learn more, but certain cancers, if we do find there's a genetic mutation, there really are specialized guidelines and sometimes therapies that we can give, patients, let them and their families know. For a patient with cancer, say someone's battling with breast cancer, there's a variety of different genetic mutations. Again, these instructions that we're born with that are supposed to be protecting us from getting cancer, that if
Hmm.
they're not working properly increases the risk. And if we know, a woman was born with one of these, that can let us know, is she at risk for another cancer? There's certain times where it can let us know therapeutics. So if anyone's ever heard about the BRCA genes, I know that was something that
Yeah.
came up in the news with Angelina Jolie a few years ago.
Yep.
But for individuals who have a mutation that they're born with in a BRCA gene, it could let us know if certain therapies, like something called a PARP inhibitor, might be more beneficial for them, might help them in their fight against cancer better than maybe just kind of some of the generalized chemotherapies that they might give to a patient in a similar situation, but who doesn't have a genetic mutation. So it can help that patient right there as well as their families too.
Yeah. No, absolutely. And so, we talk about all this great testing and kind of what it provides. Now, when we talk about getting tested, are there certain groups of people? I mean, you mentioned the BRCA gene, so thinking
Mhm.
women through breast cancer. So are there certain populations that maybe should focus on getting having some type of genetic test done, or are we really talking about the whole population?
And that's a great question. And it's something that's changing. It's always, we look to expert recommendations as well as what we're seeing in the clinic as to, who's most likely to benefit from testing. So at Karmanos, we
Mhm.
don't want to restrict anyone from being able to access these services. So,
Yeah.
anyone can inquire about an appointment, the services, the appointment is free. But really, when we're talking about who should utilize these services or who's most likely to benefit, we're talking about people where there's a strong family history of cancer, things like breast cancer, colon, uterine, prostate, ovarian, pancreatic, these cancers that seem to be more prevalent in the family than that they should be, as opposed to someone whose family history is filled with lung cancer and a lot of people who have a history of smoking. Some
Yeah.
cancers, like lung cancer, there's a heavy environmental component. Same with cervical cancer and
Mhm.
exposure to the HPV virus. So those families, if there's not really much else going on, they're less likely to benefit. That's not to say that maybe we're just not seeing enough. Maybe someone doesn't know enough about their own family history, right? That's something that a lot of families may keep certain things away from other family members, so
Yeah.
they're not talking about it. But generally, we're looking at people with the cancers I mentioned previously, people who have family histories of cancer before the age of 50, have ovarian or pancreatic cancer in the family, and it doesn't just have to be those who've been diagnosed with cancer too.
Yeah.
These are things that run through a family. So even if you haven't had cancer, but you have a family history of it, it's possible you could have been born with an increased risk that we can screen for. We can give special recommendations moving forward how to screen and prevent that. Um,
Okay.
I think another interesting thing is there are certain groups in the population. Just for an example, Ashkenazi Jewish individuals. Even if
Okay.
we're not aware of a family history of cancer, we know that the BRCA mutations we talked about doesn't just affect women; it affects men. But about 1 in 400 people in the general population have a BRCA mutation and may not know it.
Okay. Okay.
While it's less than 1% for the Ashkenazi Jewish population, that number is about 10 times as high. It's 1 in 40.
Oh
So
my
being
gosh.
part of a specific population significantly increases your risk for certain genetic mutations.
Huh.
So that's a prime example of a group of people that, just based on their ethnic background, may wish to pursue genetic testing to find out their risk.
Gotcha. Gotcha. Well, it sounds like hopefully folks are listening and whatnot, and really take advantage of that of the testing that's out there. And so, um it sounds like we're using the test to kind of find and figure out what those cancers are. But what does the future really hold for genetic testing, and where do you think we go from here?
I think that's a great question. That's something that we're always pondering, always looking to, because I think there's
Hmm.
a lot that can happen, and we're not sure exactly kind of which avenues it's going to go down. First, we're hoping that it'll be more accessible to all. At Karmanos, we're trying to eliminate that barrier of having to pay for an appointment. Unfortunately, we can't eliminate the barrier all the time of the
Yeah.
cost for the testing, but trying to get it into more people's hands, make it more widely available.
Okay.
Um, and so, we're trying to branch out to, right now you think of getting this testing a lot of places, you're thinking of going to kind of, a larger city, and it might be out of reach for urban populations. So we're working on, or sorry, rural
No
populations,
problem.
bringing that to some of
Yeah.
the rural populations,
Yeah.
making that more accessible. And we're trying to do that. Karmanos is a subsidiary of McLaren Healthcare. And so we have several McLaren sites in Petoskey, Port Huron, Macomb, Lansing, Flint, that we're trying to expand this care across the state.
Okay.
In terms of the actual testing, I think that we're going to, of course, have discovered more that we can test for already now. While there's over 20,000 genes in the human body, these instructions that make us who we are,
Yeah.
at this point, we're testing for, on average, between 80 to 100 of those genes we know are implicated in cancer.
Oh my gosh.
Compared to 10 years ago, that number was, typically around maybe 30 or less that was routinely being tested for. There's a lot we didn't know. I think we'll start to see, a lot more access to testing, a lot more that we can screen people for. And really the goal is to screen people before they've developed cancer, when there's a family history so that we can offer, for women, like the BRCA genes, you find that high risk for breast and ovarian cancer, we can start doing mammograms at an earlier age. We can add additional screening, lifestyle planning so that we can try to keep everyone as healthy as possible. So I think it'll just be something that's more accessible, something that we can test more for, that when there is cancer running through a family, hopefully we'll have more tools to help prevent that, more tools to help, individualize treatments for patients that are going through cancer and prevent them from having to deal with something like that again.
Gotcha. Gotcha. Well, yeah, I think that's important stuff. And I think I know that there are folks that are going to be listening to this and may kind of wonder, how do I get started? Is this really right for me? What should I expect? And so, I guess to kind of close out our moment here, what if somebody's looking to get tested, if they think they should get tested, kind of who can they reach out to, and then what should they expect through that process?
Of course, and I think, a great place if you have questions, if you're not sure where to go, of course, you can always go and, you can go to our website. It's www.karmanos.org. Or if you want to go specifically to our genetics page, that's karmanos.org/karmanos/genetic hyphen counseling hyphen at hyphen Karmanos. Um, and so look there for more information. Talking to your primary care physicians, though. So if you're not sure and you want to know for your own medical history, family history, you're not sure if it's right for you, obviously great to talk to someone you trust, talk with your physicians, um, just to see, is it something that's right for you? If you do want an appointment, like I said, our appointments, they're no cost. You can always call us at Karmanos. It's just
Hmm.
1-800 Karmanos. That's, Karmanos. And you can schedule an appointment. What happens during the appointment, it's very simple. There's not too much that's required. There's a little bit of homework, but it's really just finding out more about your family to know, who's had cancer. And a genetic counselor or a physician specialist, such as myself in the area of genetics, will go through your family history, your medical history. We talk a lot about, what's the testing that we can offer based on what we're seeing in the family, different screenings, different possible management that we can give to you and not just to your family. Anyone who has potentially a mutation, it's a 50-50 risk to pass on to their children,
Mm,
and same
okay.
risk for their siblings. So we talk a lot about not only the patient, and, if you're going through it, trying to figure out what's the best way we can help you, but also how can we offer preventative measures to the rest of your family. So it's really easy. A lot of testing can be actually done at home now, which is nice. So a lot of
Nice.
people wondering at home, if they're worried. I know
Yeah.
with COVID, it's thrown a
Yeah.
wrench into things. So if you're looking for an appointment, everything's by telephone and video now, at least through our services. And we can get you everything done at home without having to leave your house. It's a really simple process, just meant to be a nice conversation. So if you're interested, can always reach out to physicians or go to our website or just call and schedule an appointment.
Gotcha. Well, that sounds super easy. And I tell you, hey, I mean, a year and a half ago, we had to move
Hmm.
the show here to home. So I totally
Yeah.
understand to be able to be able to do it from home. So, well, Kristian, thank you so much for joining us today. We really do appreciate you taking the time, and thank you for those resources. We'll have those in the show notes, folks. But again, if you're looking for information, head to karmanos.org or call 1-800-KARMANOS. So again, joining us, Kristian Wilks, a genetic counselor in the genetics department at Karmanos Cancer Institute. Again, thank you so much. We appreciate it.
Thank you, Andrew. I appreciate being able to talk today.
All righty. Well, that moves us on into our here after the break. We're going to take a minute to chat with State Senator Curtis Hertel, and he's going to chat about the state budget, kind of what he sees coming out, and kind of where cancer and tobacco prevention really fit into that. So stay tuned here, and we'll be back in 30 seconds. This is the CANdid Connection.
At Karmanos, we specialize in providing cancer care that you can't get anywhere else. Because we're home to one of the largest clinical trials programs in the country, only Karmanos can give you access to more than 250 of the most innovative and promising cancer treatments available. And with locations across Michigan and virtual visits, we offer easy and safe access to the expertise and guidance of your cancer team. We do all of this for one reason: to give you your best.
Well, Ashley, coming today, we've got a special guest joining us today, and it's actually a pretty important day in terms of when we're doing this interview, because today is the budget presentation. And so, we're really excited for this next guest. That's pretty timely. And so, our next guest has been a part of the Michigan government legislature ever since he was in high school and middle school and whatnot, with his dad being a former Speaker of the House, but now moving into his professional career working at the Department of Community Health back in the day, and then being elected to the Register of Deeds of Ingham County before making his way to the Michigan Senate, where he's in his final term. And so we're super excited today to welcome our guest, State Senator Curtis Hertel. Senator, thanks for joining us today. I know you're the Minority Vice Chair for the Appropriations Committee, so you've probably got a pretty busy day ahead.
It's going to be a busy day. I'm excited to have the governor's budget presented. This is something we've been working on with the governor and the budget director for a while now, and so I'm excited for that presentation, and I'm excited to be on with you, Andrew. I've known you for a long time. You went to college with my brother, and appreciate getting to spend some time with you.
Yeah, well, thank you, and we appreciate it too. And so, like you said, today's the budget presentation. So, let's just kind of kick it off. If you can look in your crystal ball, what do you think some of the major themes are going to be in the presentation today?
I think that the biggest theme that we have coming out of this pandemic, certainly the pandemic is not over, but we're certainly starting to head towards, I think, a more endemic situation as we come out. And it's about investing in the people of Michigan. This is one of the rare opportunities where the state has lots of dollars from the federal government that are available to invest in people, solve major problems that haven't been solved for decades. And even because Michigan's recovering faster in our economy than almost any other state, our projections for general fund dollars are more than they have been in a very long time as well.
Yeah.
So when you look at investing in people, that job training programs, getting people ready for the jobs of tomorrow, investing in economic development so that those jobs are coming here. One thing we learned from this pandemic is that the importance of building things here. With the supply chain issues, with all we saw, with masks being hard to buy at first, and ventilators and all those things, we've learned the importance of actually building things in Michigan again, which is incredibly important because Michigan's a great place to build things. We have great workers. We have a history of manufacturing. So Michigan's poised to really rebound, I think, faster than almost any other state in the country because of that. But we have to make some strategic investments to get people ready and to fight for the jobs of tomorrow. And also some other big problems like water infrastructure that's been a disaster. Getting rid of the lead pipes that are around the state that are poisoning kids. Yeah. This is a really interesting and unique time to be in Michigan government because we can actually solve problems. We have a governor who's interested in solving those problems, willing to work across the aisle to actually get deals done to solve major problems that have been plaguing the state for decades. So I'm really excited about it. We're going to see a significant increase in funding for education, incredibly important. Kids have learning loss coming out of the pandemic, and we've for a long time underfunded kids' education, a huge investment in higher education, which has been really the last time we had a major investment in higher education was under Governor Granholm. We right now spend over $1 billion less. If you look at inflationary than we spent just 10 years ago on higher ed right now. So which is why kids are graduating with so much debt. The average Michigander kid graduates with $35,000 worth of debt. So this is an opportunity to actually solve all these problems at once. It's daunting. There are a lot of decisions to make, but it's exciting as well.
Yeah, sounds like it. Well, and so you focused on a couple, when you really talk about people, I mean, health is really kind of, our lane in terms of where we go. And you talked about some water pipe issues, but do you foresee any other big issues that may come up on the health side? I know, when we talk about that, prevention is really a big thing for us, and people are finally getting back into their doctors and getting some of those screenings. But do you see any other big issues, other than having to deal with COVID, that could come out of the budget and really that health side of the
Yeah, I think there's a number of things. I mean, I think that you're right that we've learned about the importance of public health and prevention during COVID, and there should be investments because of that. We've certainly learned about the people leaving the healthcare workforce. We have a dearth of nurses. We have a dearth of primary care physicians. We don't have enough mental health professionals in the state. Certainly, mental health has become an important topic during this time. It should have been before, than more highlighted than it was. If you look at our country, suicide is the number 2 cause of death among adolescents. That was before COVID. Certainly, a global pandemic made none of that better. But we have all the time teenagers that end up in emergency rooms tied to hospital beds. There is no place to send them here in the state. One of the things I've been focused on is trying to get a teen crisis mental health beds here in my community with the McLaren Hospital that's moving, and we've been putting money aside every budget cycle to finally get that project off the ground. It's going to be a partnership with our community mental health and MSU to do that. But in all these things, prevention is a huge portion of it, and I think that we've underfunded prevention programs. Not just on cancer, frankly, on a lot of things. And oftentimes we've been penny wise and pound foolish. I think that's something that we should be working to solve as we move forward as well.
Yeah, one of those areas of prevention that is continuously underfunded is tobacco prevention. We keep seeing a decline almost over the past 2 decades. Why do you think that is? Why do you not see tobacco prevention as a priority?
Well,
in the state, of course, not you.
Yeah, no. I understand. it's hard to point to what has been a priority over the last 20 years. You know, you look at the
Yeah.
onset of term limits, right? And the Grover Norquist anti-tax discussions that happen, and we have cut government to the point where you absolutely could strangle it in the bathroom. You know, I mean the bathtub. I mean that was his position, and it really has in many ways come to fruition. You know, I'll give you an example. It used to be when there was a non-emergency nursing home complaint, it would take, you know, a very short amount of time to get somebody there to review that. Now it can take months. And who knows what happens in all those times. It's just, you know, government's basic job is to educate citizens, to protect citizens and do all those things. But they have underfunded. If you look at the general fund for the last 20 years since term limits took effect, you look at just the general fund. Before now, when we're seeing this giant increase in money coming in because of how we're growing, but for 20 years, the general fund was stagnant, and I don't mean like inflationarily stagnant. I mean absolutely stagnant. It was $10 billion 20 years ago. It was $10 billion now, and so you look at that entire length of time, and obviously the inflation over 20 years is crazy, right? So at some point, everything got a little worse. Everything had to get a little worse because you didn't have the money to actually do what you were doing before. And it's not like the state stopped doing a lot of these things. We just did everything with a little less. And state employees were asked to do 2 and 3 jobs. And the funding for things went down as the costs went up. And that I think has been a great failure of term limits, because you have a bunch of people that don't really have a whole lot of experience when they go in. They're making promises to the people that they can't keep, and you know, they all want that next job, and a move away from businesses paying really any part of the cost of running state government. So if you looked at last year, the general fund, businesses paid about 5% of the total cost. Almost everything else was paid for by people. And so we've seen a major shift away from business taxes. You know, they have a lot of lobbyists and money downtown, and that certainly affects things. But it really has meant the people are paying more because their taxes have actually gone up in that same time, and that businesses are paying less, and that people are paying more to get less from their government. And that really, I think, can be seen in all sorts of funding, especially places that help people, and specifically things like prevention programs are a good example of that.
Yeah. So cancer prevention funding is also one of those areas. And, you know, a lot of the funding for cancer prevention comes from federal grants. So, you know, why do you think the state doesn't invest in cancer prevention?
Yeah, I hate to give the same answer twice, but
I was about to say, I feel like
but it is
Yeah.
sort of that conversation, right? I mean, like if for a decade you have stagnant amount of money, if something was federally funded, they said, okay, well, the federal government's giving us that money for that. We can just say we're solving that problem with those dollars, and then not actually provide additional state funding. And again, I think you used to have people in the legislature that had been here for a long time and understood the individual budget lines and were part of that process for a long time. There were people that were passionate about it, learned about it, and made those investments. And I don't think you have that now, a large part because of term limits. So I think that's one of the reasons that you see things like this, where it's like, okay, the federal government's giving us money so that we can say we're doing that. And when you have a $10 billion stagnant budget over time, and inflation chips away at everything you do, that's where we end up. And it's unfortunate because Michigan used to be a leader in prevention programs, and now we're really we're not as much as we should be. So I think these are investments that should be made. The good news is we actually have this opportunity. I mean, the opportunity is in front of us to solve large problems for the first time in a very long time, and I think we should take that opportunity invest in people, and prevention programs are exactly that, investing in people. It is it is rare in life where the less expensive thing is also the moral right? I mean, like oftentimes those don't always fit together. But prevention is a great example of that. So the long-term cost of cancer are certainly much far greater than investing in prevention. And so when you have the dollars that we have right now to make these investments, that's what we should be looking at. Instead of trying to figure out, what we can solve just in the immediacy, what can we make investments in the long term is going to make the state better, improve people's lives, but also make the state's balance sheet better. And one of those things certainly is cancer prevention.
Yeah, no, and it's I can tell you for us this term, we've recognized that, and actually we'll have at our Cancer Action Day in April, we'll be making a couple asks around this, but we'll be starting beforehand, but looking for more investments in tobacco and cancer prevention, which I've been telling everybody for years, the 6 years I've been here in the Cancer Society and even at the Medical Society, it's cheaper to pay for it on the front end than have to deal with it on the back end. And
For sure.
so I appreciate you bringing that up and having that mentality, and continue to share that with your colleagues, because there are some that still love to pay for it on the back end for some odd reason. So
Yeah, Andrew, I'm not shy. You probably know that.
yeah. So, well, as we're kind of coming to a close, we always like to do kind of a fun question. And so February means Valentine's Day, and that means there are mountains of boxes of heart-shaped chocolates at the store right now. And so if you're to get one of those for Valentine's Day, Senator, what is the piece that you're super excited about in that box?
So a couple things.
Okay.
One, first of all, I've eaten a lot of candy, as you can probably tell. Two, I like the surprise of those boxes. So
Okay.
I don't like to, I know how sometimes you can look at the map and try to figure out what you're trying to eat. I'm not a big. I want the surprise. I'm okay with that.
Okay.
But what I'm looking for, I don't like milk chocolate as much as dark chocolate. Dark chocolate's better, for sure. So I'm a big believer. I think you have to have strong opinions in life, and dark chocolate's better.
Okay.
I'm not a big fan of nuts in chocolate.
Oh, okay.
If I can get like a dark chocolate cherry cordial or a salted caramel,
See, that's me right there. I'm right there.
that's kind of my wheelhouse.
Okay.
I never look at the list. I want the adventure of trying to pick one out and going, what the heck was that? That's kind of I think the fun part of those boxes.
Yeah. It's funny. I always told I like to give sampler platters for Valentine's Day, right? Because that's what those boxes are. You just don't have the one appetizer. You just have a little bit of everything. So
yeah, it's a good deal. Yeah. But yeah, I mean, but the nut ones always throw me off.
okay.
Nuts are fine; they're good separately. But I mean, I don't understand why. I'm not a big nut and food person.
Okay.
Not just the combination
Mixed together. All right. Well, that's good to know. Well, Senator, thank you so much for spending a few minutes with us, which I know again is going to be a busy day today, and I wish you the best of luck, and and good luck with our friend Chris Harkins today, and I hope you don't beat him up.
I'm sure he'll do a great job. I'm excited to see it, and always looking forward to working with you. And it was nice to meet Ashley today, and I look forward to working with you in the future.
Sounds good. Thank you so much. Again, joining us, State Senator Curtis Hertel from the 23rd District here in Michigan, also the Minority Vice Chair for the Senate Appropriations Committee. Thank you so much. And so that does it for our interview with Senator Hertel. And we just want to say thanks for taking the time and joining us. We'll be getting ready for our episode in March, where we'll be sitting down talking more about some budget issues, and of course having our Karmanos Moment in March. So, you know, a lot to come. But again, thanks for joining us today. Ashley, thanks for being on. I thought it was a great interview and some great points from Curtis. So,
Can you believe I still am on mute?
I know. You know what? Like,
oh man,
just what we do.
You know, my dogs were barking and I didn't want them to be heard. Anyway, yes, always enjoy being on the pod and love talking to Senator Hertel. I think his focus on, prevention is a way to like help give back to the people. It's so important, and it's, something we should carry into our Cancer Action Day in April.
Absolutely. Well, and it sounds like we may have an advocate for us starting on right away, which, he's always been a real good advocate for our issues. And so, we appreciate him and all the work that he's done. But, we appreciate everyone that was on the show today. I mean, we had a great Karmanos moment as well, learned a lot about genetics and why it's important to, include that in your prevention efforts. So,
yeah. Always fun to talk to the folks at Karmanos.
Always. Well, join us again in March. We'll be back with another Karmanos moment and more information in terms of what's happening with the budget issues, and hopefully we'll have some updates on oral chemo. But with that, thanks for joining us today.
Awesome.